Welcome to D.O.T. University. I'm Ryan, the D.O.T. guy. Today we're bringing you a short video clip from our Reasonable Suspicion training for supervisors, the signs and symptoms. Now, this training can be found in its full content at dotuniversity.org. That link is in the description below. Now, make sure that you get your supervisor signed up for that training that is required for all supervisors that have interaction with CDL drivers. It's also a really good idea that you do some recurrent training with them. I hope you enjoy this clip. Now, you can help us by hitting that like and subscribe button, and also ring that bell so that you're informed when we're coming out with some new content, which will help you and your team stay off the radar. All right, for signs and symptoms, now we're going to be over here on page number 47 through 50 right now. We're going to be talking about this. So behavioral signs, it's one of the big categories. The first one, there are 4 categories. We talk about signs and symptoms of drug use. Behavioral indicators, number 1, psychomotor changes. Now under stimulants, okay, that's going to be your meth, your cocaine, alcohol, right? Alcohol starts off as a stimulant, but then it kind of drops down and turns into a depressant. But stimulants, sped up motor function, they're going to seem energized and restless. Whereas a sedative and narcotics, you're going to see just the opposite. Slow motor functions, slow and methodical. Hallucinogenics, you're going to see some bizarre behaviors, out of sync movements, responding to things that aren't there. And then, of course, we got marijuana, slow and distinct motor functions, delayed reactions, very common, poor eye-hand coordination. Okay, so again, with marijuana, you're gonna make those different types of observations. Now, under the signs and symptoms, kind of moving back, under social interaction changes, again, there could be a lot of different things that we see going on with there. Somebody could become, irritable, hostile, maybe they withdraw, maybe they become talkative or boisterous. You might see that you have some silly behavior. They could become paranoid, suspicious, or super high sensitive reactions to others, different kinds of things. Now, a lot of times these drugs, it depends on how long they've been taking them. Sometimes these effects continue, as part of that withdrawal, or as they're withdrawing from individuals with that social interaction as the drugs are tearing their bodies down. The more they use, some of these are going to become a lot more out there. Speech is another big one to pay attention to for drug use, and also with alcohol, right? Because, I'm assuming everybody in here has talked to somebody at one point in their life that has been under the influence of alcohol, and you've seen some of those things. And I'm going to kind of come back and talk about alcohol in a minute. But for drug use, again, stimulants, we're typically going to see a rapid speech pattern. They're going to seem excited, fast paced, that kind of thing. Whereas a narcotic's going to appear a little bit more slow, thick-tongued. It could be incoherent speech pattern. Now, hallucinogens, you might come across nonsensical speech. It might be dreamlike speech patterns. Marijuana, they could be normal speech. They could be talking to you in just absolutely normal. Or you could have somebody that's got a little bit of a delayed speech. Now, what I mean by that, I don't mean that their speech is delayed. I mean that they're tracking. They're like 5 seconds behind the conversation. And yeah, that's 5 seconds seems long. It depends, again, how much marijuana or THC they have in their system. Typically, this is only identified while somebody is under the influence. So if they smoked weed on Friday and you're talking to them on Monday, they're probably going to appear absolutely just fine. Okay, so you wouldn't have any signs. But this is, again, if they had it in them, say somebody's dosing themselves with edibles, that's something you might notice. And it might be just the slightest little cue. You're just having a conversation, and all of a sudden you notice that they're just a little bit beyond, okay, or slower behind the conversation. You might notice some giddiness. They're chuckling, they're laughing, and it's just not really fitting for the situation, or it's more than was required for the situation. They could have some difficulty forming some sentences. The psychoactive drugs, again, it could be incoherent, slurred, stupor of speech, or they could be completely unresponsive. They could be mumbling. You can't understand them. Now, if at any time in those types of situations, if they can't respond to you or whichever else, you probably are going to need to get medical help, okay? Something's going on with a certain individual. Same thing, you could come across unresponsive speech if somebody is on narcotic, because it's incoherent. Again, that's going to be one of those things. You can't ask somebody to take a test when all they're saying to you is, ruh, 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 ruh. Okay? That's going to require you to get them some medical help. They may need to get something in their system to wake them up and bring them back. Okay, personality changes, okay, which is one of the most difficult to identify, and that's why it's so important as you as a supervisor that you have interaction, with these individuals. Okay, these observations, because they're difficult to notice, again, knowing them, knowing how to have a conversation with them, this is not the day that you want to go up and have your very first conversation with them, because again, there's nothing to balance that conversation against, to say, hey, where is that individual out? Typically under personality changes and things like that, a quiet and introverted passive employee may become just the opposite. They might become outgoing, aggressive, obnoxious after using jugs, whereas an outgoing or assertive person, somebody that's usually loud, they may be just the opposite and appear more withdrawn, isolated, out of touch. Again, different things. You're going to notice there's a social change within that individual. I hope you enjoyed that short video clip. Now remember, you have to get your supervisors trained in this, and if they have been trained, it's just been years they've been through it, make sure that you go to DOTuniversity.org. Link is in the description below. Get signed up for that. There's a special coupon code. You might have seen that flash through. Make sure you're using that. Get trained. Train often, train frequently. Come back and check us out. We're coming out with some new content that can help you stay off the radar.